I'm often asked about, men and the usage of testosterone therapy, maybe it's going to cause prostate cancer. And what the recent research, and this comes from Harvard University, Abraham Morgenthaler, basically has debunked that idea. It's not testosterone, it's not high testosterone levels that that encourage the development of prostatic cancer. It's low levels of testosterone that affects a non-protective state for the prostate. And that low testosterone allows for estrogen to increase, and when the estrogen goes up and the testosterone is down, the prostate cell becomes very susceptible to the action of dihydrotestosterone, which is circulating in a man's system continuously. And dihydrotestosterone will stimulate that cell to start forming abnormal changes that can lead to precancerous cells or to prostate cancer. In fact, at Harvard, if you have a tumor which is not spread outside the prostate and has a negative lymph node evaluation, when you are evaluated afterward, if you are low in testosterone, they will give you testosterone as soon as your PSA is close to 0. If your PSA is 0 and your testosterone is low, they don't want you to die of a heart attack, a stroke, or shorten your lifespan, because testosterone is crucial for men. Without it, we can use 10 years on our lifespan. We increase our chances of osteoporosis. We triple our chances of Alzheimer's. We exacerbate the loss of muscle and increase the chances of joint degeneration into osteoarthritis, and develop problems with our metabolic system to where we get that quote-unquote beer gut, which is not a beer gut. It's a gut that comes from insulin resistance, and the more fat you deposit, the more insulin resistant you become. That leads to obesity, which leads to diabetes, high blood pressure, and a lot of metabolic problems that will shorten your lifespan in a very short order. So usage of testosterone is not dangerous. The only time you shouldn't give testosterone to an individual who has low testosterone is if he already has prostate cancer that hasn't been treated yet. You don't do that. That's common sense. But even if they are prostate cancer survivors who have had localized tumors and have a negative evaluation, after a few years, the usage of testosterone is perfectly acceptable.